Good morning. I am Mr. P. Manikam from SRM Institute of Science and Technology. I am working as Assistant Professor in the Department of Mechanical Engineering. Today I am going to speak with you about the biomechanics of the human spine. Generally, biomechanics is the area, it is a branch in the field of the applied mechanics. Basically, the, the biomechanics was derived from the mechanics which is basically used in our general field of engineering. The aim of the biomechanics is to study about the role and function of the forces and the moment generated in the human body. Initially, it was developed from the continuum mechanics. Now, it has been generated to work with the molecular level mechanics also. Now, the basic principles of the engineering mechanics are being applied in the musculoskeletal system of the body. Our body is considering the complete skeletal systems are classified as bones. There are totally 206 bones are there in our body. Everywhere there is some scope of biomechanics is there in the all parts of the body. So we are going to concentrate on the biomechanics of the human body as well as the spine. Now, while we are speaking about the entire body, I am taking spine as my area, and I am going to briefly explain you about what are the different types of biomechanics there is applied in our human spine. Spine is the main part of our body. Again, the spine is whichever we call as the backbone of our body. That full is called as the spine. Now, while we are taking about the spine, it was classified into three areas. While in the spine, the cervical spine is one of the most complex complex structure in the human skeleton. That is the one thing which which is making a connectivity between our head and the spine. That is the very important area while we are analyzing the things. Now, clinical problem of the human cervical spine are more in our society. For example, the persons who are sitting for a long time, they are facing the problem like pain. For example, neck pain they are facing. Those who are sitting more time in the computers, they are facing the neck pain. And for example, those are sitting doing hard work, they are having the problem in the lumbar spine, and probably they will have the back pain. So this is the common problem which are there in our society. Now, what is our aim? While we study the biomechanics of the complete system, we can understand how the load distribution is done over the entire body. At the time, we can know how we can avoid some kinds of the load. For example, while we are lifting some things, we should know how to lift the things. In that, biomechanics play a major role. Otherwise, what it will happen, if we, without knowing, if we are lifting some of the heavy weight, what will happen, it will lead to the disc degeneration or some problems. For example, in our society, generally there are some problems which I am telling it to you now. Example, spine deformity. For example, when a child is born, at the time itself the spine may go for deformation. That I can classify as scoliosis. For example, somebody, the spine will not be in the same alignment, it will go for a curvature structure. So because of that, their growth and everything will be affected. Next one is the spine tumor. Suppose some of the cancerous growth or cells can affect the spine, that is called as the spine tumor. Suppose spine injuries, sometime while they are driving the car, due to car accident or some of the fall from a tree or something, they may face the spinal injury. That is also a very big problem, and including trauma, spinal cord problem. Suppose if the disc is degenerating, it will affect the spinal cord. It will what it will do means, it will not affect, it will affect the blood flow of the spine. So that is the major thing. Because of that, it will create some numbness all over our body, leg, hand, and etc. And cervical disc disorder, sometimes what will happen in our neck. For example, while we are seeing long time the computers or some of the television, if you are watching the things, what will happen, the disc will go for a degeneration or a disorder. Because of this, more problems may occur. And after that, disc displacements, the disc will move from its original orientation and it will come to a new orientation. That is called as a disc displacement herniation, and at last it will come to a problem called disc degeneration. So these are the major problems of the spine. And after that, finite element method is the technique. For example, in order to view these problems, we are using the finite element method as a tool to find out the finite element method to find out the internal stress and the strain in our body. In the intervertebral disc, for example, what is the pressure it is generated over there, under static loading what it is happening, under the dynamic loading what it is happening. For example, the different types of loading conditions are, for example, compression. It will have a tension, it will have flexion, extension, lateral bending and torsion. These are the different kinds of the loads which are took by the spine. Now molecular structure, for example, in the clinical biomechanics, if we considered, what are the different words we can use? Biomechanics is like a middle part and it can be used for so many technologies. For example, molecular structure. Nowadays we are concentrating more on the molecular structure. If I am going to study the molecular structure using biomechanics, that is called molecular function. For example, molecular level we can do the studies. Then cell membranes, how the cell structures appears. There, if you use the word biomechanics, then it is called cell membrane functions. Each cell, how it is being done, like that we can study. Then cell structures, how the structure it is there, what is the anatomy of the structure using the biomechanics, that is called as the cell function. Next is called tissue structure using biomechanics, that is called as the tissue function. For example, small tissues, intervertebral disc is a tissue in our spine. How the forces, what are the compression loadings, different type of loadings which is acting over there in the each tissues we can study. That is called as the tissue function. For example, that is what they are telling. The biomechanics, the middle name of the biological structure and its function. For example, if something is being done, we are using biomechanics and categorizing it with the help of the what is the force generated there, what are the different kinds of force with respect to x, y and z coordinate systems, and what are the different types of rotations it can take place at the point. That all combinedly we will do. That is called as the word biomechanics plays a major role. Then afterwards, bioengineers use mechanics to invent the, for example, patient related studies also they can do. Somebody will have for example, lifting loads at the time, how it may affect their spine or how it may affect the body, like the different types of the studies they can do. For example, sports biomechanics is a major area. In that, what they will do, how to run in the, if you are keeping the body position in a different manner, they can increase their speed and the related things they can. That field is called as the sports biomechanics, how the body works. And after that, if how the for example, if a bowler need, or how he can increase the speed of his bowling, like that each and everything can be studied with the help of the biomechanics. Next, coming to our area, this anatomy of a spine. In the anatomy of the spine, if you take the spine, see, this is our head, this is our head, this we will call it as a skull structure. This is the skull, and the skull is being connected with the spine. So from here, if I am telling, this is the spine, this is the starting place of the spine. This we will call it as a cervical spine. The cervical spine, we will call it as these bones as vertebrae. These are all the bones, we will call it as a vertebrae. From here, if I am starting, this is called cervical bone. See, cervical is starting from C1 to C7 level. Each vertebrae we will number it like 1, 2, 3, like that. Totally, if I am counting in the cervical spine, total number of vertebrae are 7. So we will call it as C1 to C7. This is directly connected to the C1 is directly connected to the skull. That we'll call as atlas and dens. That name is atlas and dens. And after that, the remaining from C3 to C7, we will call it as a vertebrae. The top region is called atlas and the dens. And after that, the next, this is the topmost area. For example, why it was given in different colors, the reason is, suppose if the disc in this level is getting degenerated, what it will happen, from C1 to C4, if some degeneration is there, they will have a breathing problem. Like that, each vertebrae, next C1 to C3, head and neck, in that a place a problem may occur. Then in C5 means shoulder, C6, C7 if a degeneration, wrist and elbow, and C7 triceps, like that. C7, C8, they will get the problem over there. Next is this second level is called as the thoracic spine. In this thoracic spine, additional to this, they'll have a ribs also. Our rib cage also is being attached with this spine. That is why we will call this area as a thoracic spine. The thoracic, the entire thing is called as the thoracic spine. It will have a ribs. So T1 to T12, that is the level. It starts from T1 and it ends at T12. This is a different thing compared to that of the cervical and lumbar. This is the different thing. It will have the ribs also with it. And if you see this curvature, this is same. This curvature, it is coming in this direction. And the cervical and this lumbar will form a same curvature levels. That also need to be noted here. And after that, from this bottom level, we will call it as this, from this to this L1 to L5, we will call it as lumbar spine. L1, L2, L3 and L4 and L5. 5 vertebrae are there in the lumbar spine. So from this level, we will call it as a lumbar spine. And the bottommost area, which is having some of the fused vertebrae, we will call it as a sacrum. The main thing of the sacrum is at the bottom part of the body, and the remaining thing is called coccyx. Now we are seeing it here. For example, I am taking this and I am showing it is in a big manner, C3 to C7. This is a cervical spine, middle and lower cervical spine. This area is called lumbar spine, L1 to L5. Now these vertebrae, in between these vertebrae, we will have one disc. Okay, each level we will have a disc. L1 to L2, there is a disc. This component is called as the intervertebral disc. The main aim of the intervertebral disc is in order to give the cushioning effect for the body. Suppose if you are jumping, this will act as a shock absorber of a body. In a mechanical term, we can tell this this act as a shock absorber for our body. Next, this area is called lumbar spine. This is called the atlas and the dens, which I told you, that is called upper cervical spine, middle cervical and lower cervical spine. Then like that it was classified. This is the complete anatomy of a human spine. Now if you are going to the next level, what are the different things we need to know in the total structure, architecture of the bone. For example, if you are studying about any bone, we should know how the structure appears inside it. Then only we can assign the material properties for the bones, or we can relate it with the mechanical terms. For example, if you are seeing here, this bone is called as a vertebrae. This component is called as a vertebrae. Now, this vertebrae is made up of two level of different kinds of bones. That is, one is called cortical, which is the outermost part of the body, that is called as a cortical, and inside the cortical it will be their bone called cancellous. This cancellous is a spongy type of bone. It will take the compression load of the body. That is why it is designed in this manner. The outside edges are called cortical and the inside bone are called the cancellous. These completely, if I am thinking with respect to mechanical, it is a completely an anisotropic structure. So the next one is, if I am coming here, this vertebrae, in between these vertebrae, this structure is called as a intervertebral disc, which I showed you before. In the intervertebral disc, what is the main objective? It will act as a shock absorber. It will give a cushioning effect. Suppose somebody are jumping, this will take the load, compression, tension, both it can take. Now if you are taking this structure and if you are studying, the outside area is called as annulus fibrosus. The annulus fibrosus is the area which is coming at the total outside, that is called as the annulus fibrosus. The next area is called, the inside, the outer wall is called annulus fibrosus, and the inner thing which is there is called as the nucleus pulposus. The main aim of the nucleus pulposus is like a watery, it will like a gel. Okay, to protect that only, this outside it is made as a walls. This is the main thing of the intervertebral, main anatomy of the intervertebral disc. Now if you are considering this, after this at the top there will be a layer called end plate, vertebral end plates. The main aim of the end plate is it will join with this cortical and this cortical, the top level plates, that is called as the vertebral plates that will be at the top and the bottom, we will call it as inferior and superior vertebral plates. If it is top with respect to this, then we will call it as superior vertebrae. If it with respect to that vertebrae it is at the bottom, then we will call it as inferior vertebral plates. This is the main thing. In between two vertebrae, this is what shown here. This is the vertebral end plates, and in between the two vertebrae, that component is called as the intervertebral disc. Same like that, this is called anterior side. This is called as the anterior side. In the anterior side, these are all the components which are there. Now let us go for the posterior side. In the posterior side, what are things are there means facets. This anatomy is called as the facet anatomy. In the facet, it will be in the facet, for example, vertebrae level, for example L1 L2, let us take it as like that, L1 level, L2 level. In the L1 L2 there will be a intervertebral disc over here, and in the L1 facet, L2 facet, here what will have a joint capsule, because while we are going for a flexion, extension, rotation, and after that lateral bending, these facets will transfer some of the force, which we are going to see in the later slides. Okay, then there will be a fluid called synovial fluid enclosing the facet space. Here there will be a fluid that is called as the synovial fluid. Suppose what will happen for the old age people, the synovial fluid will become dry. Because of that only they will face some pains in the remaining things in the knee joint or somewhere. That is called as the synovial fluid. This area is called as the articular cartilage. Bones are different, cartilages are different. Cartilage is like a soft, the structure will be very soft. This area is called as the cartilage. For example, here and here there is a cartilages are there. So this is the architecture of the bone. For our spine completely, this is the main architecture we should know. Now while we are considering with respect to the mechanical terms, the bone we can take it as isotropic bones. With respect to finite element study, we can take it as isotropic. Someone takes its orthotropic or anisotropic. Like the different types of studies we can do. And disc, they are modeling it as intervertebral disc using some fluid models, because this inner is made up of fluid. So fluid mechanics will plays a major role over here. So fluid model also we can model using the finite element analysis. Then this is the common structure. Here generally we can give the contact analysis, contact mechanics here, because it is getting contacted with both the structures. That is why we will use the contact mechanics. That is very, very important over here. Now after this, the main thing, the next one is, now we are going to see about the physiological motion of the spine. Generally the physiological motions of the spine that I'm going to explain with the head. For example, head and the neck, if you see, the first, this is called as flexion. If it is moving forward, that is called as a flexion. If one is moving forward, then we will call it as a flexion. Next, if I am going backward, that is called as a extension. That is the second one. Third one is lateral bending. Lateral bending can be done in two manners with respect to the left as well as to the right. We will call it as lateral bending left or lateral bending right side. Next is the axial rotation. The axial rotation which can be done in two directions. That is, one is left axial rotation, next one is the right axial rotation. That is the basic motion of the head and the neck. This is same applicable as well as for the lumbar spine and also the thoracic spine also. Now while we are dealing with the mechanical terms, we will classify. I am taking a vertebrae and a disc and a vertebrae. That is called as a functional spine unit. That is called as a functional spine unit. In this functional spine unit, what I am considering: forces, moment, translation and rotation. For example, the first point, if I am taking with respect to that, if it is rotating, if it is a rotation, then we will call it as a this moment. With respect to the force, that it will go for a translation. The load, for example, if I am applying a load, it will go it will go for a displacement. For example, if I am applying a force, this will go for a translation. If I am applying a moment, that will go for a rotation. For example, if you are taking here with respect to this axis, with respect to the three axes x, y and Z. Each axis it will go for one motion. For example, we can consider this. This, if I am taking in this X axis, it will go for flexion and extension. That is the this and this with respect to the vertebrae. Next, in this axis, if I am taking Z axis, it will go for a lateral bending left and right. Next, if I am taking this as a Y axis, this will go for a axial rotation. It will go for a axial rotation. The main thing is force, it will be given there, and because of the force, it will go for a translation. For example, if I am applying a force over here, what will happen? This bottom will go for a translation. Force in the sense, if I am going for a flexion here, this will go for a translation. Same time, if I am doing extension, here you can see the translation. So these are the different types of forces which is being given there. See, this is a force, and because of that it may go for a translation. That was given here as a arrow. Then with respect to the moment which is going over here, this may go for a rotation. So that is why we will call 6 degree of freedom system. It can go for flexion extension 1 and 2, lateral bending left and right again 2, rotation with respect to the left and right again 2. These are the 3 different these are the physiological motion of the spine. For example, if you are taking here, what I am doing, see, this is a functional spine unit. This is the functional spine unit. There is a vertebrae here, there is a vertebrae here. This is a flexion with respect to this is a extension. Lateral bending with respect to left and right. And after that, the third one is the axial rotation with respect to left and right. These are the 3 main physiological motions which you can see in the spine. So it was being explained here in a detailed manner. So vertebrae is there. This is the moment axial torque. This will call it axial torque, lateral bending, flexion and extension. If with respect to x coordinate system it is going here, it is called flexion. If it is going this direction, next direction, opposite direction, that is called extension. Same thing, moment, translation and rotation. These are the things which is very important. This is where we are applying the mechanics on the human body. Till this much time we are speaking about the anatomy and how the structures appear, how the material appear. Now this is where the real biomechanics is starting over here. Now moment, translation and rotation, these are the entity which we are going to find out, and we are going to find the solutions. Now the important thing is the forces acting on the spine. Just we studied now different type of force and moment which is acting over the spine. Forces acting on the spine includes the entire body weight. The body weight, for example, cervical spine, if I am taking it, the head alone it carries. So head weight alone will be there. And after that, the tension on the ligaments. Next I will show it to you in the next upcoming slides. And tension on the surrounding muscles, intra-abdominal pressures. These are the major force which is acting over in the spine. The entire body weight is shared by the spine and the spinal ligaments which is over there, and after that the muscles over there and intra-abdominal pressure. These are the various force which is acting in the spine. And the major form of loading of the spine is in the axial direction. And the next one is the mobility of the spine. If I am taking this, these are the different range of motion. Now I will start the word called range of motion: flexion, extension, lateral bending and axial rotation. These 3 are the different types of range of motion. Now the spine motions were characterized with respect to the neutral zone. What is the neutral zone? The meaning is where there is no resistance. In the case, suppose the neutral zone, in the sense it is at the rest position. It is at the rest position. It will not go either for flexion nor it will go for a compression. In between that range is called as the neutral zone. The displacement of the neutral zone may be 0.3 mm for tension and compression and 0.8 mm for shear. Next, the zone is called as the elastic zone. What is the elastic zone? Till the elastic zone, what it will happen? It will go to a range of motion for a flexion or extension, and it will regain to its original position. That is called as the elastic zone. Generally, we are operating our spine mostly in the elastic zone only. Then next is the range of motion, the displacement of a motion segment. For example, 0.1 to 1.9 mm in tension, compression, shear. That we will call it as a range of motion. If you see the picture here, you can understand this position is called flexion. See, he is going forward, that is called flexion. He is going backward, that is called as a extension. If you see here, this is a bending. With respect to this is the left side bending and right side bending. These are the two type of the bending which is over. Then axial rotation with respect to the left and the right. That are the main three which